Ya Allah, Subhanallah, Ya Allah, Alhamdulillah, Ya Allah, La ilaha, Allahu Akbar, Ya Allah, Subhanallah, Ya Allah, Alhamdulillah, Ya Allah, La ilaha, Allahu Akbar.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. You are welcome to another episode of Today's Woman, the African Pride. And today we're going to have one of those medical episodes, which is very exciting and informative. And with me in the Wahab Adams studios again is the Deputy Director of Nursing Services, Mrs. Aisha Ajua Boating Ahmed. You're welcome to the studios once again.
Thank you.
So we're going to be talking about tonsillitis today, what it is, what does it do to the human body, and how, we can tackle it as a whole. So Mrs. Aisha is going to walk us through everything. So straight before we do anything, let's just get into the basics of tonsillitis. What is tonsillitis?
Well, tonsillitis, as the name implies, is an infection of the tonsils, which is found in the gland. It's a gland which is found at the back of the throat. And when it becomes inflamed, that's when, so when we say the tonsil, the itis means the inflammation.
Right.
So basically it's the infection of the tonsils.
Okay.
And it's very common, just that we get it more in children than the young adults.
Oh, is it?
But yeah, that's what happens.
Okay,
and also, this tonsils is also part of the immune system. It protects us from the body from getting infections. So when you get inflamed like that, then your body is at risk.
Oh, okay. So it's supposed to be some sort of barrier from infections. And then it's capable of getting infections itself. Yes. That's very important.
Yes,
it plays an important role.
Yeah.
See, so what are the causes of tonsillitis?
Basically, it's viral, but we have some percentage that is bacterial.
Okay.
And then it's from droplets, or let's say it's airborne. So there's sneezing around, coughing into the air and all that.
Okay.
If you inhale them, you are liable of getting it.
So everybody's
at risk.
Yes.
Okay. Everybody's at risk. So that's why it's important to cough into something or sneeze into something, so.
So this kind of culture shouldn't be cultivated just because of the COVID-19.
No. It's something that is there, and we are now reinforcing it because of the COVID.
Yeah. Okay. So what are some of the symptoms? Let's let people know how serious it gets.
Most of the time, we do get sore throats, either in the throat or in the tonsils itself, or sometimes you feel the pain in the neck.
Okay.
So that one is one, and then. When you are swallowing, there's so much sharp pain, especially when the food we are eating is also having a little bit spicy. I'll say spicy. And then body temperature too goes up. In adults, about 37.5 onwards. And then for children, 38. Children are strong.
Right.
So theirs becomes very manifest when it's high. But, apart from that, children, they normally get. And it's rampant because of the cold and cough that they've been getting. They are always liable to. And then you feel weak. You don't feel like eating. You don't feel like eating. You feel like you want to sleep all the time, and you feel so unwell.
So you get a fever.
You get a fever, yeah.
So it isn't just like a small, infection in the throat. It takes a hold of the whole body.
Because it's part of the one that protects the body from infections.
Right.
So it's your immune system that is being attacked at the moment.
Right. So you made mention of difficulty in ingesting food. Does that mean that it gets sore?
Yes, it gets sore. That's the sore throat. And then also it gets inflamed. It becomes bigger.
Okay.
Yes,
use the simple terms for us, because it becomes bigger. Okay,
yes.
So it's swelling.
It's swelling. So you can feel it even if you use your hand to touch under or in front of the upper part of your neck.
Wow.
You can feel it.
That shows how intense the pain must be.
Yes.
Wow.
It shows.
Wow. So.
And then even when it's inflamed, you also can see that you try bringing out a lot of flames because it becomes pussy. So the flame starts coming.
It produces pus?
Yeah.
I see. Let's say it seems like a very troublesome.
But yeah, it's a very troublesome one. And you can imagine, can you be swallowing your pus? I mean, it's not possible.
Wow.
Apart from it being painful.
Wow.
Something else.
Wow. So at this point, I'm sure anybody listening will want to know, how do you treat it quickly as possible?
Yeah, and then sometimes your voice also changes. That's why we should also be aware of that.
Not only does it get inflamed and sore, your voice can change.
Yes, it's like you cannot talk well, you become very hoarse, and people may not hear you. Even speaking out is another problem for you because it's inflamed and it's painful. Yes, the air that enters makes it worse. So, you don't even feel like opening your mouth to talk.
So speech becomes a problem.
Yeah.
Eating becomes a problem. And then it produces...
Swallowing becomes a problem.
It produces pus at the same time.
Yeah. So it's not a funny thing.
Just to skid a little away from my questions, I understand that the throat, the nose, and the ears have some sort of connection.
Yes.
And so when one is in trouble,
the others too.
So does that mean that you have, complications with your breathing?
There'll be running nose. Your ear too becomes painful. Some of them even it extends to that, so that even when it touch the earlobe, they feel painful.
So the pain becomes external. It's not just inside of
you
feel
not the pain itself, but when you touch it, you feel the pain inside.
Right.
Or when you touch your cheek or close to the ear, it becomes so painful for you.
Wow.
So it's affecting because you can also have headaches. You can also have headaches because of the inflammation, the swelling.
Yeah.
So
I mean, it's affecting your main organs, your throat, your ears, your nose. That's very serious.
You'll be surprised that this tonsillitis can affect the whole body.
Yeah, because you made mention of fever.
Yeah, it can affect the whole body.
Wow, that's interesting. So how do we treat it, or how do you diagnose,
Okay, usually, just looking at it may not confirm that it's tonsillitis the person is having. So they usually do a throat swab. They use a cotton wool tip, a stick with cotton wool on, and then they'll just open your mouth, they touch it with it, clean it, and then wipe it, and then take it to the lab to see whether it's a viral or it's a infection, a bacteria.
Okay.
If it's viral too, they normally have to take, if it's bacteria, then they'll put you on antibiotics. But if it's viral, then that means they have to take blood sample to find out the type of viral that is causing that's harm. And that why you need to boost your immune system.
Not to cut you, you made mention of the tonsils being so it isn't like the appendix that doesn't necessarily have it actually has an active role in your body. So does that mean that when you have tonsillitis, there's a high possibility you have other infections, because now its position has been compromised, and so it means that your body gets to be exposed to other infections.
Yes, and because of it, it can cause you other infections.
Right.
The passy thing, pus and from the throat you can swallow. Yes, so it can extend to your chest, which can affect your heart.
Right.
So you can have heart problems, and it can also affect your kidneys, because we ingest in the stomach, and then the work process goes through the kidney before it's brought out. So it can also affect your kidney. That can give you the nephritis. They call it glomerulonephritis.
That's a heavy name.
Yeah, that's a heavy name.
I wouldn't dare repeat it.
And it says it's also in the throat. We have other organs in the throat.
Right.
They can also get affected, like the pharynges and all that. They can become passy to the extent that swollen and passy to the extent that we have to cut open to bring the pus out. Otherwise, it can go into your system, so you get septicemia. So the blood infection.
Oh, wow.
So
you're exposed to heart disease, kidney problems, and your blood can get an infection as well.
Yes. So
that's very serious.
It's something that we need to be very careful.
So you covered the diagnosis. You can do the swab and then they check if it's viral or an infection. What are some of the treatments that you would like to go through?
So if it's bacteria, they'll put you on antibiotics.
Right.
And these antibiotics, you need to take them. You need to, but some of them, it's response to treatment. So maybe if taking the first 3 days, you are feeling okay, now you can eat, you can swallow, the pain is gone down. Don't think you are out of the woods yet.
Right.
You need to finish the full dose, the full course that you were given.
Okay.
And then whilst in the home or anywhere that you are, you need to take certain measures. So you need to have saline gargle. like warm water with salt.
Okay.
You gargle with it.
Okay.
And then you bring it out. You gargle and bring it out. So that it also helps soothe it. And then you can also take ice cream, which is cold. It numbs it so that you can swallow better. And then with children, for instance, you can also give them, you can give them warm juice.
Right.
Warm juice. Even adults can take warm juice because it becomes very difficult for you to eat. So we have to take soups, food that are so light and can also nutritious at the same time so that you can ingest. Otherwise, you'll be hungry. For children, they will be weak. Even adults, it's not easy. How much more? The children, they will be weak, so they will prefer not to eat.
Yeah.
You don't have to worry. Just for a day, you don't have to worry.
Right.
When they get better, they will start eating. So just make sure that they give them juice, ice cream, soups, that there are no spices in. It will help. Adults can take aspirin for the gargling.
Okay.
But they should make sure they don't swallow it.
Oh.
The aspirin too helps it.
Okay.
And we can take the paracetamol.
Okay.
Paracetamol
So they should
too.
avoid the aspirin.
Aspirin for children.
For children.
Yeah, but adults can control it better. So they can use the aspirin for the gargling.
Right.
It's very helpful.
Okay. I'm just realizing how problematic this, this infection could be, because for people who have experienced it, cold water is not the most advisable thing. However, you still need something cold to numb it. So then you're cutting.
Yes, because of the sharp pain that you get.
Right.
So the cold water, or let's say ice cream. Normally, we don't even say use the cold water. We normally want you to take cubes of ice.
Oh, okay.
That
so
one
not
is
necessarily liquid, but something that is...
so that you can be sucking on.
Right.
Okay. But the ice cream, it really, really helps. It really, really helps. So that one can be taken. So in addition to your paracetamol and your antibiotics, I think so for some people 3 to 7 days, they are better and they are out of the woods. Okay. Sometimes it takes a while, especially if it's viral. It's for about 2 weeks. Some people will still be under.
Okay. So even if you get better, do you still have to continue with the antibiotics, or you just,
it's a course. If they say you should take 10 days, you should finish the 10 days.
Okay, so you shouldn't be like me that
when
I
feel better. No, you don't have to. You need to finish it, because if it's bacteria, it can come back. And also, when you do that, you rejuvenate the bacteria. If it's bacteria, because they get used to it, they cannot work out and overcome the medication.
Right.
So then the next time when they give it to you, it won't work again.
Okay. So
you need to, so that they don't get used to the drug.
Okay. Now I'm interested in this because after you take a treatment, a course, does that make you still prone to it? Can you ever get it maybe in a few years?
We have 2 phases: the acute phase and then the chronic phase.
Oh,
so the acute phase
to get to the chronic phase.
Yes, the acute phase is what you just maybe it's the first time you're having it, so you get it and you are treated and you are fine. But if you reinfect yourself again, then it's becoming unbecoming. It's like it's following a trend.
Wow.
That becomes a chronic one. So some people can get it 3 or 4 times in a year.
Oh.
And that one is not good. It's now chronic now. So I know some people have it. The little thing, they are getting it. So the use of masks was good then. But now that we are talking, there are some people who have it, and now because of the mask they are wearing, they said that for a whole year now they haven't had that incident anymore. Yeah. So it's like the dust and all that are factors, because it's airborne. You've been inhaling.
But
and then it's very contagious in the sense that when you use the same spoon with somebody who has it, it can affect you.
Right. Before we get to, because there's this part of my question that we get to the chronic part and how far it could go. But is it possible that it's hereditary?
For that one, I'm not very, very sure. But for what I've been seeing, I can see that a mother has it. Then, so they can be explained in the sense that they are all in the same house, so they contaminate each other.
Oh, okay.
They are using the same bowls, the same spoons, the same cups.
Right.
So they can get infected.
Right. But it doesn't necessarily mean that
it's a hereditary thing.
Right. Yes. So it's just solely an infection to the gland.
Yes.
There's not anything that is carried on. Okay, so you spoke a little about the ice cream. Is there any other thing like home care you can practice?
Yeah,
aftercare.
The home care, it's the one in the hospital is almost the same thing.
Okay,
but there are additional things that you should make sure that you do. You have to separate the utensils from the main house, and then if there's a shelf, toothbrushes and all that, they want to have to be separated.
Right.
And they shouldn't share the same cup. And if it's bottled drink or something, nobody should drink from it. And then also, share. In addition, you can just pour it into separate cups and then they can take them.
I mean, this thing you're saying shouldn't be taken with a grain of salt. It's actually important because you made mention of the fact that there's pus coming out from this gland and nobody wants to be ingesting that.
Yes.
Yes. Wow.
Yeah.
Okay.
So it's very important that you do kind of barrier nesting. We call it barrier nesting in the house.
Okay.
You make sure that, so even if it's towels and things like that, you just make sure that you wash them well. So that because you may never know.
Yeah. And
it's very contagious. If you sneeze in, you inhale and then you can get the bacteria inside you. So it's very important that we adhere to those rules and regulations.
I see. So now let's get to the chronic part. What does somebody expect when they have chronic? They keep having that infection back to back.
Yeah. So that means then that you may have to go for a surgery.
That far?
Yeah, you may have to go and remove your tonsils because it's giving you a lot of issues, and you don't want to get heart problems. We call it the rheumatic fever, which can cause you heart rhythm. You can also get the glomerulonephritis, which can also be another issue altogether. And we don't want to have the septicemia too.
Right.
So if you're the one that you're always getting it, within a year you can get 5-6 times. So why keep it then? Because they normally don't want to remove it, but if it's that troublesome, then you may have to.
It's very scary to think that I'll remove my tonsils.
Yeah. They do remove and they're okay.
Okay. So at what point, so you get it, frequently, like more than 4 times or more than 3 times in a year. The best thing to do is to take it out because it could lead to
other situations that you may not survive it.
Okay. So now my question is, the purpose of the tonsils was to be a barrier for infections. Now it has gotten too bad that you are getting infections. Then you go do surgery, take it out. What is now protecting you?
You have other lymph nodes there. The other lymph nodes is just one part of the lymph nodes that is in the body. So the rest are also there.
Okay. So
but this one, because you still have other bodyguards there. This one, because it's easy to get infection because of the...
Right, it's just directly at the back of your throat.
So we always say that dental hygiene, mouth care is also very important.
Right.
Very important.
Right. I really appreciate that this particular thing is very laced to hygiene, at home and personal hygiene as well.
So it's very, very, very important.
That's really interesting. What are some of the complications that you can get? You made mention of the heart, but then like after surgery, I'm aware that people, irrespective of what they went to surgery for, there's this, extra complications that comes with this.
Well, for the tonsils, there's nothing. You don't get anything.
Right.
Yeah, it's removed. You don't feel anything. I mean, it's because you don't even see, you don't feel it even when it's there. Just that when it gets infected, that you feel it. But if it's removed, it's the same thing. You don't feel nothing. But you can have complications if it is there and it's troubling you. It becomes very worse to the extent that you can have difficult airway obstruction. You cannot breathe. You can choke in your own saliva because it's producing a lot of flames and things like that. You can choke it and then die. And then the air too cannot come out. So it's also another thing that can happen. It's another complication that can happen. And then, as I said, the glomerulonephritis, that one too, because you've ingested, it's gone through the system or to the kidneys. You may even not notice it until it's too late. And kidney infection to lead to so many things. Yeah, so which you can lose your kidney, you can have a chronic kidney disease. So it's not something that you normally
Would you advise that, if you get just one infection with your tonsils, you just, quickly run and take it out?
No, nobody will do it for you.
Oh, okay. So it is
when it's persistently worrying, because you may have it once in your lifetime.
Okay.
And you can take care of it and you're fine.
Okay.
It doesn't get repeated.
Okay.
Fine. But if it's the persistent ones, that becomes an issue.
Okay.
Otherwise, nobody will take it out. Just say, just first time you're running away. No. It's two. So both sides. So if it happens, I mean, they have to remove both. While the other one has got nothing wrong with it. So it's only when it becomes persistently persistent.
Okay, so let's run back to the surgery. What is the recovery process like?
Oh, they ask for that one. It is, some of them been doing it under local, like you don't sleep. But most people want to sleep before.
Okay.
It's true, because they will just put something in and then pull it out. They don't cut. They cut nowhere. They open your mouth, they gag your mouth, open it wide. And they have some tonsils. We have a forceps that is called tonsil forceps.
Okay. Specifically for
yes.
that. Right.
So they put that one in, that's click it and then pull it out. And while they numb the place so that you don't bleed. So that's when they do the surgery it's always important that you take the ice cream and then the ice cubes.
Okay, so right after the surgery, you can take.
Yes, when we come back, before you recover from the anesthesia,
right?
They tell you to take. They'll give you, of course, the pain medication, all right, just to bring it down. But it helps best if you take the ice cream. It numbs it down so that you can recover very fast and start eating. Right. So you start with the soups and things like that. Then you go to the hard ones, then come back to normal. Okay, so 5 days maximum. You should be up and up. Even the children, 3 days, you see them when they start eating the ice cream without having any problem. They go home.
So it's not something that would keep you in bed for a very long time.
No. Even the first day, the first day after you've recovered from the anesthesia, you can be up and about.
Okay.
They don't cut, so I mean, no visible cuts anywhere.
Okay, okay, that's amazing. That's really amazing. We've covered a lot. I'm a bit scared, but then the ending made me satisfied because at the end of the day, you can take it out and you'd be fine. What advice would you have for our viewers, to wrap this whole thing up?
Well, so I would say that tonsillitis, though it's an issue, it's also not too much of an issue if you take good care of yourself. So we can do the oral hygiene very well, and also we plead that if you want to sneeze or cough, you can sneeze or cough into your elbow, especially the left one.
Right.
So that at least, or you put on masks. Or if you have a tissue or something, you can do that in, so that you don't infect some, because some people are susceptible to it. So it will help all of us, and then we can stop the spread and we can stop the infection too.
Right.
So that we limit the number of cases that comes out of this situation. And it's not scary. If you have it, you just pop into the hospital and everything will be fine. The operation is done only when it's very necessary. Apart from that. Yeah, because if you don't take good care of it, you can have so many things that can lead you to your death. Like the septicemia or sucking blood infection, your heart infection. Then it goes into your the urine through your kidneys. So the kidney, and no kidneys, it gives us a lot of problems. So if you take good care of it, you don't have any issue with that.
Right.
And then it can obstruct your airway, breathe in, and you can die immediately, because before help can come. Because the thing has closed, the airway has closed, because the tonsils have become so huge with pus and all that. And it's hard, because when there's pus inside, so it's very hard. So it will be difficult to open it. And that one, we need a major operation to cut and then put some tube in for you to be able to breathe through that. So please.
Right. I was going to, wrap up, but then I just thought of this in our country. There are people who would easily, walk into, a medical facility, but then there are people who would rather, use resort to herbal solutions. There's so many unorthodox, solutions. Or use abonkini on your ear, or use, something, to give you some temporary relief. How advisable is that?
I think that one is the individual's perception.
Right.
But from the orthodox side, it's best you come to the hospital so that apart from you taking a pain medication like paracetamol to bring down the fever and the pain, you need to come to the hospital for them to do the best, because we have to find the cause. If it's viral, we need to do something about it. If it's bacterial, we need to give you the antibiotics. So it's important you come. So that if you realize that you have, you come, and whatever advice is there, we will give it to you.
Okay. Okay. Talking about the paracetamol, is there any other thing that somebody would like to self-medicate at home that could worsen, the infection?
Yes, some people do take, just as you were saying, the Abonicare and all that. There are other types of paracetamol that's in the system. Gibidol and things. Even the aspirin, some people tell you can take the aspirin.
Right.
Well, the best one that I know that brings down inflammation fast is the brufen. But brufen too has its causes. It can cause your tummy to bleed. So bleeding in the stomach. So you need to know how to take care of it. So that's why we suggest that you take just the paracetamol and you come to the hospital so that we stop anything that is any adverse effects that you may have from other things that you take. Somebody will tell you, take this concoction, swallow this, take this leaf, take that. They are all something that it cannot be proved. But we've realized that the kidney issues are becoming more and more. And then the bleeding from the stomach too is becoming more and more due to these measurements that we do. Because the leaves and things, we don't know the measurements. Some may be good, it may be of help, but it's a measurement. How many are you supposed to take? So they are all issues that come in. And if somebody is sick, you become very vulnerable. Anything everybody says, you take.
For relief,
So before you realize, you've hurt your liver, you've hurt your kidney, and you've hurt the lining of your stomach. So it's good you come.
So it actually could go left. It could go really, really bad. So the best thing is to go to the medical facility, be diagnosed,
sort it out,
and then go through your treatment.
Because even this, sometimes there are other conditions that may have the same symptoms as other tonsillitis. So it may even be in those conditions, not the actual tonsillitis, and then you hurt yourself more. Because now the ENT conditions are becoming many when it comes in terms of cancer. There are many, and they all start like that. I was having persistent sore throat, so I was going for lozenges, I was going for this, I was doing that, they were doing it on their own, but they never went to the health facility for a proper diagnosis. So we advise that you come. Let us differentiate between what is happening and whatever we thought it was, so that at least you get a better help. Because the ENT conditions, they can easily treat. To
be clear, ENT is ear,
nose, and throat conditions. You see, the nose, ears, and throat, they all have the same line. So anything that happens to one also can affect the others. So it's always important. Because for my unit, for instance, we've been having a lot of the cancers from the ear, nose, and throat. And when they come, they'll tell you about it. It started as the cough, sore throat. So I was going to buy lozenges. I was taking Strepsils. I was doing this. And then somebody said you should use the neem tree for gargling. So I was doing that. I mean, they'll tell you all sorts of things. And it was not going. Maybe it's after 6 months, I decided to report myself to the hospital. And they told me to go and do tests. And they told me when I came out, they told me I have cancer in my throat, or cancer in my pharynx, or cancer in the three areas. So it's becoming unbecoming. So we need to be careful.
Brilliant. So we have been speaking to the Deputy Director of Nursing Services. She had so much information to give us on tonsillitis. It doesn't seem like a thing that people talk about much. For some people, they think it's a common sore throat, but it could actually lead to so many unthinkable complications. You could have, heart issues. You could have kidney issues. And trust me, nobody wants to have any issues with your heart, your kidney. Those organs are very, very, crucial to the human body. And even worse, you can have an infection with your blood. And I don't think I need to speak much on that. You know how bad that could get. The tonsils, as Mrs. Aisha Adjwabwating Ahmed mentioned, are glands at the back of your throat. They're actually visible if you open your mouth, wide enough. And they are glands that protect the body from, am I correct
infection,
to say antibodies?
Yes, antibodies.
Antibodies, right. They protect the body from antibodies, and then they can actually get infected. So the right thing to do is to make sure that you take, your personal hygiene very seriously, and just hygiene in general should be a culture that you live by, and try and sneeze into your elbow, and all the precautionary measures you take when it comes to, sneezing, eating, coughing, etc. This has been today's woman, the African Pride. We have been talking about tonsillitis. I've had, an amazing time with Mrs. Aisha Ajwa Boating Ahmed. I'm excited to have had her in this Wahab Adams studios again. My name is Hiba Farouk. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
And there is no God beside him, the knower of the unseen and the seen. He is the gracious and the merciful God. Oh Allah, you are most great. He is Allah, and there is no God beside him, the knower of the unseen and the seen. He is the gracious and the merciful God. Oh Allah, you are most great. Oh Allah, you are holy. Oh Allah, we praise you. Oh Allah, there is no God, you are most great.